I specialize in urogynecology. If you have an issue with prolapse or incontinence or any other pelvic floor related problems, then those all treatments and investigations are offered here. If you have issues with endometriosis, fertility issues, issue with periods, heavy period, light period, no periods, all those things we can discuss, we can offer, we can investigate. Hysterectomy, particularly the word means removal of uterus. Hyster is a word used for uterus in Latin. There are certain misconceptions about hysterectomy which I would like to clarify at this stage. When we say hysterectomy, that's the uterine body removal. But most of the time with hysterectomy, we do remove cervix as well. Cervix is the neck of the womb, opening of the womb. But when we say hysterectomy, that doesn't necessarily mean that we are removing ovaries and tubes. So if you are going to have a surgery, then it is important to know that along with hysterectomy, are you having your cervix removed? Are you having your ovaries and tubes removed? Any type of the gynecological issues ultimately may lead to hysterectomy. For an example, if you have a prolapse, and if it's a uterine prolapse, you need a hysterectomy. If you have endometriosis, which is not responding to other treatment options, you may need hysterectomy. Fibroids, heavy bleeding, pelvic pain, these are the other reasons why you may need hysterectomy. Other simple things like if you're of certain age group, and if we are going to operate on your ovaries for big ovarian cyst or any other indications, then your gynecologist might advise you to have hysterectomy at the same time. For every condition, we look at the whole treatment range and then decide which one is best for you. And from that point of view, proper consultation is very important. It depends on the reason why you are advised to have hysterectomy or why you would wish to have hysterectomy. For an example, if you have a fibroid, yes, ultimately we can take out the uterus along with the fibroid and relieve your symptoms. But at the same time, there are injections that we can give you, there are tablets that can be given, or the blood supply to the fibroids can be blocked, and that's how we can shrink the size of the fibroid. Another example I would give you is if you have a prolapse and you need some treatment, then you can have just simple thing like vaginal pessary to control the prolapse and carry on with that till you need to have major surgery. So as a clinician, I would always say that first thing is we need to look at the condition. Along with that, if you have any other problems, and then go through all the treatment options, and then what fits maximum in your situation, that's what should be the starting point. It's a major operation. It does have a recovery period. You do get pain, and even when we do the hysterectomy in a minimal access way, what is defined as keyhole surgery, even then internally you would be healing, you would have all the recovery period to go through. But once that is done, you don't have much side effects from the actual operation. When ovaries are taken out with the hysterectomy, and if you were not menopausal at the time of the surgery, then you do get the symptoms of menopause, and it does need looking at whether you would be benefited by HRT or not, hormone replacement therapy or not. Uterus can be taken out in different ways. If you have an open surgery, which used to be the conventional way to take out the uterus, so you have a cut on your abdomen, which could be sideways, which could be up and down cut, then your recovery period is longest, which is usually about 6 weeks when you're up and about, but overall healing may take up to 3 months. Whereas nowadays more often we do keyhole surgery. The perceived duration of recovery obviously is a lot quicker. It's usually expectation is within 2 to 3 weeks you are up and running. Third way to take out the uterus is vaginal, where especially if you have prolapse, then that's the most commonly done operation. And in that case, again, if it's just hysterectomy where the uterus is taken out, uterus and cervix are taken out, then recovery period is again 2 to 3 weeks and you're up and running. Many times that sort of the operation does have some other vaginal repair work done as well. So if there is any additional repair work is done, then your recovery could be slightly longer. but maximum up to 6 weeks and you're back to normal. Usually hysterectomy takes anywhere between an hour to 2 hours, as long as it's a straightforward operation. Sometimes, especially if it's a big fibroid that we are taking out along with the uterus, or if there are ovarian cysts, it can take longer. Conditions like endometriosis, or if you have multiple surgeries prior to your hysterectomy, and if it has left you with adhesions, which is the scarring inside the abdomen, then it may take a bit longer. It is a major operation. There are a number of different options, so please be guided by your clinician. It's a good operation. It does solve the problems, but always start with the simple things, and if it doesn't work, then take it as a final option.